dental, in-network only. Still has transportation. And we have transportation on all of our HMOs in 2025, just not on our PPOs. So we removed transportation on our 2 PPOs, but all of our HMOs still have transportation. All right. So now this is our preferred full savings plan. They get, it's full based on the prior year, but they get 100, your members would get $174.70 back on their plan, or back on their Part B payment. Again, this is a plan that is pretty well suited, very well suited for veterans. I have VA coverage and don't necessarily need the benefits from a MA plan, but they could use that money back. Some of the other benefits, this plan was new for this year. $500 dental allowance is on this plan. $500 isn't going to cover much, but it's an allowance. It's, and transportation. Transportation, we have 10 one-way trips. And I think this might be it on our featured plan. So this plan, preferred Medicare plan, is a really solid plan as well. It's good for people that are looking for a low max out of pocket. It has a larger PCP network than the Alliance plan. I talked about it a little bit, but when we were talking about value-based care, our Alliance plan, you already saw how strong that plan was or is. The Alliance plan has less PCPs in the network than all of our other plans. All of our other plans have the same number of PCPs, and it's all a little bit higher than Alliance. And that's because the Alliance plan only has value-based providers in that plan. We expect more from those providers that are contracted on Alliance. So all of the providers that are on Alliance are on that full risk contract that I was talking to you about earlier. So my point for bringing that up and what jarred my memory is that the preferred plan is an excellent plan if you compare it to any other plan out there, with the exception of the Alliance. So the preferred plan is a very solid plan because it has the same PCP network as all of our other plans, but look at the benefits that it has. $2,900 move. You have a $30 specialist copay. You see your inpatient care hospital stay, has a decent amount of transportation and 24 one-way trips. So the preferred plan is a really solid plan, especially if it wasn't competing against Alliance in our portfolio. I mentioned HMOs are less expensive to maintain, and that's kind of our bread and butter. We have 2 PPOs. They're not the most attractive PPOs, to be honest, but we're still paying commissions on them. We don't expect them to go away. They're not going away in 2025, for sure. I don't know what's happening with them in 2026. I suspect they're still going to be around. I haven't heard anything different, but that's the reason that we removed them from the electronic platform. So we just didn't want to make it easy to keep on writing.